everyone. I'm Dr. Michael Dwati, RCMA President. Welcome to our monthly call with our Riverside County Public Health Officer, Dr. Jeffrey Leung. I want to thank our 2021 President, Dr. Ajit Singhvi, for hosting these calls for the past year. And I look forward to continuing these calls until the need subsides. As a reminder, all lines are muted to avoid background noise. If there is time following the submitted questions, you can enter additional questions through the chat feature, and we will attempt to get to those. With that said, I will now turn over the call to Dr. Leung to give us a COVID-19 update in our county.
It's just below 20% right now. Our hospitalizations, which were once above 1,000, are now at about 600. And our new cases are starting, have been declining steadily. So, as related to this, we also see a number of upcoming changes from the state perspective. The first thing is starting effective February 16th of next week, the universal indoor masking requirement goes away. It'll be replaced by what we had in place before December 15th. And as a reminder, in early December, it was required that anyone who is unvaccinated mask indoors. And then there were a series of special locations in which masking was required for people, whether they're vaccinated or not. So that will also be the case effective February 16th and going forward. So places that will continue to require masking of everyone, regardless of vaccination status, includes healthcare facilities, schools, such as K through 12 grades, child care centers, transportation hubs, public transport like buses and trains and ride shares, homeless shelters, emergency shelters, cooling centers, skilled nursing facilities, and adult day care centers, just to list a few examples. So there's still a number of sites that will continue to require masking, but given that the surge is sort of starting to improve, and that vaccination rates are also improving, there will be a loosening of the masking requirement. Along with that, as of February 1st, there was originally an all facilities letter that had provided an exception for healthcare workers who were asymptomatic and positive to continue working. That actually went away at the beginning of the month. So now we sort of revert to the previous guidelines for healthcare workers. So, we assume that, many of you have probably had conversations surrounding this topic at your workplace. The governor also recently signed into place again a COVID sick leave. So the last time, good through September of 2021, then that benefit had gone away. And now that, so the 0 to 4 Pfizer has not been approved yet, but there is a scheduled FDA and CDC meeting next week and the week after. And there are some anticipated shipments if everything goes through. So we could expect, vaccine to be arriving as early as the end of this month, if we get the approvals from both the FDA and the CDC. And that would be for the 6-month-old to 4-year-old category. So those are probably some of the major updates right now regarding COVID. Thank you, Dr. Dwati.
Great, thank you so much, Dr. Leung. So we do have some prepared questions that we received before the call. So the first one is, we have started hearing talk about the need for a second round of boosters and possibly needing a booster vaccine every 5 months to keep a high level of protection. Can you provide any data behind these emerging recommendations?
The data, especially the data, is somewhat confusing, in that it depends on whether you're looking at sort of new cases or hospitalization or death as the outcome. And in general, what we've seen is that, with these vaccines and boosters, there may be some waning of that efficacy starting at, 5 months, especially in older individuals.
it really depends on the group that we're looking at. So again, for younger people, vaccinations and boosters, seem to be highly protective and probably for a longer period of time. And then for older individuals, this is the group that we're really worried about. They seem to, lose some of that efficacy. And it's because, after 5 or 6 months that we also start to see increased risk for hospitalization and serious complication that, you see these more aggressive sort of campaigns for boosting. So that's all. Thank you.
Great. Thank you so much. So the second question is, COVID-19 therapeutics continue to be in short supply. Is there any information on increased production and allocation to Riverside County?
Yeah, so we know this has been challenging, and of course we have different types of therapeutics. We do believe that we heard on a state call that there might be a slight decline in demand, especially probably as we're seeing a drop in cases, and we do expect the oral antivirals to get better in several weeks, but that won't happen, that quickly. In terms of, the sotrovimab, which we know is in short supply, we do have one site at the RUHS Medical Center that is also state sponsored. So we have sort of a better supply there, and they are having some availability of appointments there. If you go to the RUHS Public Health website, the coronavirus webpage, there's actually a treatment options button sort of in the upper left-hand area, and that actually shows you a map of where all the different treatment or therapeutics are offered and what types of therapeutics are offered at each site. Although we do recommend calling the sites, before sending patients there, writing prescriptions or making referrals, just to make sure that they have those therapeutics in supply.
The next question is, what information can you provide on Public Health Department COVID-19 compliance inspections of schools and businesses? Have any orders to correct or fines been issued? Is there any discussion as to the removal of the indoor mask mandate for our schools?
So, in terms of schools and businesses and being in compliance, the biggest challenge that we've seen is with a large number of cases. Oftentimes schools and businesses are struggling with both reporting and sort of doing their own form of contact tracing and just making sure that everybody's getting tested. For places that have sort of blatantly been out of compliance, we've tried to do as much education as possible, and when needed, we will forward sort of issues to the appropriate governing body. So we have done that on occasion, but again, we try to educate and support first.
And then the last prepared question, and then we do have some chat questions, is, as a physician, it is becoming increasingly difficult to defend the constantly changing data and COVID-19 recommendations. There appears to be no clear education/communication campaign from any governmental agency that we can provide to our patients. After 2 years of the pandemic, the absence of this clear and simple education in a format that would be acceptable to the community at large continues to fuel widespread misinformation, conspiracy theories, and resistance to vaccines, masking, etc. Is there anything you can do to help with this problem?
So, this is the $100 million question. And I think, this sort of hits on all of the challenges that we're having with education, with sort of constantly changing guidelines. What we've tried to really do from the county standpoint is to stay aligned with the state. And it is difficult to do that because things, when the science changes, when the surge gets better, when staffing shortages improve or get worse, we see things changing at a state level, and then we try to adopt them at a county level. From a public health standpoint, we just try to be as transparent as possible and try to stay in close contact with major stakeholders and cities and schools and different groups to let them know what we're hearing as soon as we hear it. From an individual physician standpoint, we know it's also really challenging because you could be providing some guidance one day and then 2 weeks later it could be very different. So we think that the relationships that each of you have with your patients and your communities and just being really trusted messengers, helps all of us during this sort of otherwise very chaotic time.
Thank you, Dr. Leung. I know that's a very difficult question to answer. So we do have some questions from the chat. So I'll just go through these. So the first one was, how often do exempt clinic employees need to be tested?
So in general, exempt clinic employees need to be tested once a week. Employees in sort of more high-risk settings may need to be tested more often than that, but we'll see how the guidelines evolve over time. So it has been once a week for clinic employees, though.
Thank you. The next question is, in our office, if an employee gets COVID and is out of work for 10 days or more, how can they get compensated if they no longer have any sick days left?
Yeah, so at this point, there are probably only a couple ways. So first of all, the COVID sick leave pay has been reinstituted. That was just signed by Governor Newsom this week. And that is retroactive back to January 1st for anybody who's had a COVID infection, and goes through September 30th and provides, up to essentially 2 weeks, of sort of paid or benefit time. But the other route is, in that language, they will say, if people can work or telecommute or work remotely, that's another option that employers can consider.
Thank you, Dr. Leung. The next question is a more open-ended question. Just, can you speak a little bit more about the medical exemptions for vaccination? So maybe just a real high-level overview of the medical exemption.
So the medical exemptions, for vaccination have been somewhat controversial, but the bottom line is, the exemption needs to be signed off by, a medical provider. It cannot be sort of an exemption that is done by a patient for themselves. It has to be signed off by a provider, a licensed provider. And then in terms of the guidance for, who deserves or who, should be able to get an exemption, in general, we think if people have had terrible reactions, sometimes people are severely immunocompromised, they're getting cancer treatment or something else, but really we think the true exemptions should be few and far between.
Thank you. And then the last question that I see in the chat, Dr. Leung, is what are the rules for masks in a doctor's office starting February 15th?
Yeah, so the rules for masks in doctors' offices do not change. So healthcare facilities, clinics, hospitals, skilled nursing facilities will still have required masking for staff, for visitors, for patients. And whether people are vaccinated or not vaccinated.
Great. Thank you so much, Dr. Leung. Those are all the questions that we had prepared and that popped up in the chat. So thank you again so much for your time. Thank you, everyone, for attending. And Dr. Leung, thank you again for the update.